بسم الله الرحمن الرحيم. يسعد صباحك أو مساك دكتورنا الغالي. أنا الطالب محمد عبد الناصر خليل طبل. سوف أتحدث عن acute kidney failure in cat due to non-steroidal anti-inflammatory drug. Introduction. NSAIDs are non-steroidal anti-inflammatory drugs that act as analgesic, antipyretic, and anti-inflammatory agents. NSAIDs are the most effective drug. The pharmacological effect of NSAIDs depends on the dose and duration of use. NSAIDs can cause change in the gastrointestinal tract and cardiovascular system and blood platelets. Therefore, caution should be made and referred to the veterinary before administering this medicine to the animal. NSAID and hydroelectrolytic disorder, COX-1 and COX-2 and metabolic acid due to decreased renal perfusion activity. PGE2 inhibits vasodilation by acute prostaglandins. The prostaglandin is a self-regulating mechanism. PGE2 in cases of reduced renal perfusion, which means if production is reduced in synthesis in renal failure disease and hyperkalemia, it is normal for plasma retention, which leads to electrolysis disturbances of water and acid base. So animals who suffer such condition associated with the use of NSAID more likely to develop acute renal failure. Also, NSAID may reduce the response to diuretics by about 20%, especially loop diuretics. Another study demonstrated a correlation between the effect of both classes, COX-1 and COX-2 inhibits, causing low renal levels in cat proculatal. Reverted this result with the use of meloxicam in rats. NSAIDs and acute renal injury. Acute kidney injury includes a syndrome characterized by a sudden decrease in the glomerular filtration rate, resulting in urea and creatinine retention that are eliminated by the kidney. The main form of acute kidney injury caused by NSAID is hemodynamics. Therapeutic dose of NSAID in susceptible animal can cause acute kidney injury. This prevents prostate biosynthesis involved in it, and the risk is higher. Main NSAID effect on kidney function. Acute kidney injury mechanism: hemodynamic alteration, kidney perfusion reduction. Risk factor: liver disease, kidney disease, heart failure, dehydration, advanced age. Acute interstitial nephritis, hypersensitive reaction. Risk factor: prolonged NSAID exposure, some specific NSAID. NSAID-induced kidney injury pathophysiology. The kidney are important organ for the excretory function of the body because they receive about 25% of all cardiac output in order to adequately perform their filtration function. This organ have regulatory mechanisms such as prostaglandin synthesis, which will maintenance glomerular filtration rate, and renal hemostasis. NSAID inhibits that cascade of arachidonic acid selectively or not, causing a non-permissive effect on the formation of prostaglandin in the kidney. Prostaglandin, mainly prostacyclin PGD2, will act as vasodilators in the afferent arteriole, increasing renal perfusion with distribution of the cortex fluid to the nephrons in the renal medullary region. The vasodilation acts as a negative feedback on the mechanism, such as the performance of the renin, angiotensin, aldosterone system, and the sympathetic nephron system. And the sympathetic nervous system, culminating with compensation to ensure adequate flow to the organ. NSAID inhibits this mechanism and may result in acute vasoconstriction and spinal cord ischemia, which can lead to acute renal injury. In addition to the vasodilation action through the stimulation of tubular receptors, PGE2 will inhibit the transport of sodium and chloride in the ascending loop of renal and in the clotting ducts by means of stimulating of the EP1 receptor, leading to neutrosis. In addition, PGE2 excretes an antagonistic action on the antidiuretic hormone receptor, also promoting diuresis. NSAIDs might also cause higher sodium and water retention by inhibits PGE2 production, leading to the formation of edema, which is often subclinical. Clinical trials comparing different NSAIDs show the development of hypertension, especially when using high doses and for prolonged time, with ibuprofen being more involved. In addition to its action in the kidney, prostaglandins perform several functions related to homeostasis, such as protection of the gastrointestinal mucosa, platelets activation, inflammation, and other. Pathophysiology of kidney injury to NSAID. Non-steroidal anti-inflammatory drug inhibit cyclooxygenases. Cyclooxygenases act in synthesis of hemostatic prostaglandins, prostacyclin, and PGE2 and PGD2, responsible for vasodilatory distension and decrease renal vascular resistance and increase renal perfusion. Cyclooxygenases culminates in decrease total renal perfusion and medullary influx diffusion, decrease GFR, and sodium and water retention, resulting in renal vasoconstriction and medullary ischemia. Chronic effect can resulting in chronic kidney disease and acute kidney injury. أتمنى قد ينال إعجابك، وأتمنى يا دكتورنا الغالي أن هذه المعلومات قد تكون كافية حول موضوعي. والسلام عليكم ورحمة الله.